Dear students, under the topic biological products, we are now going to cover blood products. A blood bank is a place where blood is collected from donors, typed, separated into components, stored, and then prepared for transfusion to recipients. Typically, each donated unit of blood is separated into multiple components such as RBCs, plasma, and platelets. Each component is generally transfused to a different individual, each with different needs. Apheresis is a common blood bank procedure. It is the process of removing a specific component of the blood, such as platelets, and returning the remaining components, such as RBCs and plasma, to the donor. This process allows more of one particular part of the blood to be collected than it could be separated from a unit of whole blood. Apheresis is also performed to collect plasma and granulocytes. Accident victims, people undergoing surgery, and patients receiving treatment for leukemia, cancer, or other diseases like sickle cell anemia and thalassemia utilize blood. Now, there is another term, autologous blood donation. The patients scheduled for surgery may be eligible to donate blood for themselves. This is called autologous blood donation. In the weeks before non-emergency surgery, an autologous donor may be able to donate blood that will be restored until the surgical procedure. Once the blood is drawn, in a blood bank it is tested for number 1, ABO blood group type, number 2, RH type, whether it is RH positive or negative. Then number 3, for any unexpected RBC antibodies that may cause problems in the recipient. Number 4, screening tests for evidence of donor infection with hepatitis virus B and C, HIV, human T lymphotropic virus, that is HTLV1 and 2, and syphilis. The whole blood is normally separated into several components. RBCs may be stored under refrigeration for a maximum of 42 days, or they may be frozen for up to 10 years. Platelets are important in the control of bleeding and are generally used in patients with leukemia and other forms of cancer. They are stored at room temperature and may be kept for a maximum of 5 days. Fresh frozen plasma, or FFP, used to control bleeding during low levels of some clotting factors, is usually kept in the frozen state for up to 1 year. Cryoprecipitated AHF, which contains only a few specific clotting factors, is made from fresh frozen plasma and may be stored frozen for up to 1 year. Granulocytes are sometimes used to fight infections, although their efficacy is not well established. They must be transfused within 24 hours of donation. Usually, around 500 ml of blood is withdrawn during blood donations. The blood is collected into an anticoagulant solution. A sample of blood is collected at the time of bleeding and subjected to serological and virological tests. Anticoagulants are used to extend the useful life of red cells following storage under proper conditions. Following storage under proper conditions, the blood can be used with safety for a period of 21 days after collection. These anticoagulants are of 3 types. Number 1, calcium sequestering agents. Number 2, heparin and heparin substitutes. And number 3, prothrombopenic anticoagulants or oral anticoagulants. You see, calcium is essential for several steps in the clotting process. Hence, its removal prevents clotting. The calcium sequestering agents tie up the calcium and other divalent cations. They are only employed in withdrawn blood. Therefore, it is most commonly seen in anticoagulant solutions used by the blood banks. These substances act rapidly and their effect can be overcome rapidly by adding or otherwise restoring calcium to the normal. Therefore, citrate containing blood is in effect recalcified on transfusion back into the bloodstream. A commonly used anticoagulant is CPDA1, where C stands for citrate, P stands for phosphate, D stands for dextrose, and A stands for adenine. Citrate acts as an anticoagulant by binding with calcium. Phosphate acts as a buffer. Dextrose maintains red cell membrane, and adenine provides energy by supplying ATP.
In a first step towards clot formation, platelets are recruited to the site of vessel injury by now exposed molecules of the vessel wall, such as collagen and von Willebrand factor. This factor mediates the linking of platelets to collagen via a specific receptor in the platelet membrane. The resulting change of shape of the platelet from its resting state into the dendritic form indicates activation. The activated platelet in turn releases prothrombotic molecules such as adenosine diphosphate (ADP). By binding to its receptors, ADP induces aggregation. And recruits further platelets to the site. Thromboxane is another important mediator of platelet activation and aggregation. Under its influence, the platelets cross-link with each other. These interlocking mechanisms cause platelet activation to snowball. The clot grows rapidly. Activated platelets also trigger the coagulation cascade and thus the formation of thrombin. Thrombin, in turn, stimulates platelet activation even further, a continuous feedback loop. Additionally, thrombin induces the formation of fibrin for the mesh stabilizing the clot. The self-reinforcing process of platelet activation, crucial in the formation of blood clots, is an obvious therapeutic target in conditions caused by inappropriately triggered blood coagulation.
Platelet concentrate. They are of two types. One is random donor platelet concentrate and the other is single donor platelet concentrate. Let's talk about random donor platelet concentrate first. Each unit of platelet concentrate is prepared from a unit of whole blood by centrifugation within 8 hours of phlebotomy. Phlebotomy means collection of blood sample. It can be stored up to 72 hours at 20 degrees to 24 degrees Celsius with agitation unless collected in specialized platelet packs validated for longer storage periods. Random donor platelet concentrate is used in the treatment of bleeding due to thrombocytopenia. Thrombocytopenia is a condition in which there is low blood platelet count. The platelets stop bleeding by clumping and forming plugs in blood vessel injuries. After collection, platelet concentrates are infused as soon as possible, generally within 4 hours to avoid any kind of bacterial growth. 4 to 6 units of platelet concentrates should be infused through a fresh standard blood administration set. It is always to be kept in mind that platelet concentrates prepared from any Rh positive donor is not to be given to Rh negative female with childbearing potential. It is preferred to give platelet concentrates that are ABO compatible. Then is the single donor platelet concentrate. This component is collected from an individual donor with the help of apheresis. A single unit of apheresis platelet concentrate is suspended in 200 to 300 ml of autologous plasma. 1 unit of apheresis platelet concentrate is equivalent to approximately 6 units of random donor platelet concentrate. It is useful for patients who are likely to receive long-term platelet support, such as in case of aplastic anemia or bone marrow transplantation recipients. Single donor platelet concentrate can be stored up to 72 hours at 20 to 24 degrees Celsius with agitation, unless collected in specialized platelet packs validated for longer storage periods. Please keep in mind that it is not to be stored at 2 to 6 degrees Celsius. Then is the single donor platelet concentrate. This component is collected from an individual donor with the help of apheresis. A single unit of apheresis platelet concentrate is suspended in 200 to 300 ml of autologous plasma. 1 unit of apheresis platelet concentrate is equivalent to approximately 6 units of random donor platelet concentrate. It is useful for patients who are likely to receive long-term platelet support, such as in case of aplastic anemia or bone marrow transplantation recipients. Single donor platelet concentrate can be stored up to 72 hours at 20 to 24 degrees Celsius with agitation, unless collected in specialized platelet packs validated for longer storage periods. Please keep in mind that it is not to be stored at 2 to 6 degrees Celsius. Plasmapheresis is a process of removal of plasma. In this procedure, the plasma is separated from the blood cells and is replaced with fresh frozen plasma. The rationale for plasmapheresis is based on the fact that circulating substances such as toxins or autoantibodies accumulate in the plasma which block certain receptor sites, thus giving rise to many autoimmune diseases. Various drugs given in such diseases not only have deleterious side effects but also are known to completely cure the disease. Human albumin is a sterile, non-pyrogenic preparation of serum albumin. It is obtained by fractionating blood, plasma, serum, or placentas from healthy human donors and tested for absence of hepatitis B surface antigen. The albumin content is not less than 96% of the total protein. The solution contains 5 or 25 gram albumin respectively, corresponding to 100 or 500 ml of normal human plasma. It contains sodium caprylate as a stabilizing agent. The solutions are heated in final containers at 60 degrees for 10 hours to kill any pathogenic organisms that may be present. The solution should be checked for any turbidity or if there is any sediment. These are moderately viscous, clear, brownish fluids. They are odorless and may develop a slight granular or flaky deposit during storage. Human albumin serves as an emergency agent for restoration of blood volume in the treatment of hemorrhage or shock. It is indicated when blood loss exceeds 20% of blood volume. It is used in protein replacement therapy when serum protein levels are low because of excessive loss, as in extensive burns and nephrosis. Albumin, in any sense, does not replace the red cells and therefore it should not be used in hemorrhagic shock except as an emergency remedy. Albumin is contraindicated in congestive heart failure. Large doses should not be given in severe anemia, in low cardiac reserve, and in the absence of hypoalbuminemia. You see, hemorrhage and shock results in loss of blood volume. If this is carried beyond a certain critical point, it leads to circulatory failure. Replacement of the plasma proteins or injection of a substance having similar osmotic properties will restore the blood volume, at least for the time being, so that the circulation of oxygen to the tissues may be maintained. Many substances have been used for this purpose. Whole blood is ideal in certain situations, but is generally not available readily. Plasma is pretty effective, but then it is unstable in liquid form. It is difficult to handle in dry form. Otherwise, it involves injection of salt and water, which is in some cases not desirable, and finally cannot be rendered free of pathogenic viruses. Then comes serum albumin, an option. The protein in the plasma that functions to control the blood volume and polysaccharides, such as dextrans and hetastarch, could be used. Dextrans come as dextran 40, dextran 70, and dextran 75. All these are polymer of glucose with an average molecular weight varying from 40,000 to 70,000. For the preparation of dextran 40, sucrose is subjected to the action of bacterium leuconostoc mesenteroids B512 and the crude high molecular weight dextran, which is then formed, is hydrolyzed and fractionated to an average molecular weight of 40,000. Dextran 40 is a white amorphous powder which is odorless and tasteless. 10% solution in 5% dextrose in water darkens slightly over a storage period. It is freely soluble in water, soluble in dimethyl sulfoxide, and insoluble in alcohol or ether. It has the property of lowering the blood viscosity and improving its flow. Therefore, 10% of dextran 40 in isotonic saline solution or 5% dextrose is superior to dextran 40 in whole blood. Dextrans decrease platelet adhesiveness. This property is used for prophylaxis of thrombosis and thromboembolism during and after surgery. The size of molecule is such that polysaccharide is filtered in the glomeruli more rapidly than larger macromolecules such as dextran 70 or 75, which we are going to discuss next. Renal failure, severe congestive heart failure, severe coagulation disorders, hypervolemia, hypersensitivity, and severe dehydration contraindicate the use of this substance. It also interferes with some tests of renal and hepatic function. The preparation of dextran 70 is similar to that explained in dextran 40. The only difference is that the product is then hydrolyzed and fractionated to adjust the molecular weight to 70,000. It is again fine white amorphous powder. It is odorless and tasteless. It is very much stable in light and is hygroscopic. The commercial grades generally contain 5% water. It is freely soluble in hot water, whereas dextran 40 was freely soluble in water. It is also freely soluble in dimethyl sulfoxide and insoluble in alcohol or ether. Dextran 70 is a great plasma expander for prevention and treatment of hypovolemic shock. Hypovolemic shock is a life-threatening condition in which more than 20% of the body's blood or fluid supply is lost. This fluid loss makes it impossible for the heart to pump a sufficient amount of blood to the body, thus leading to organ failure. Dextran 70 is contained within the plasma and hence retains the fluid in the vascular bed by osmosis. Although dextran 70 solution is inferior to plasma, it has many advantages that refrigeration is not required and the solution does not have to be prepared immediately before use. Thus, it may be kept for use in emergency vehicles, etc. It is also less expensive than plasma. But like plasma, it is inferior to whole blood as a replacement when hypovolemia is due to hemorrhage. The side effects of dextran 70 include allergic reactions such as hypotension, fever, anaphylaxis. The drug is contraindicated when there is hypersensitivity severe coagulation disorders, severe congestive heart failure, and hypervolemia. HETASTARCH or 6% hydroxyethyl starch has an average molecular weight of 200 kilodaltons and a colloidal osmotic pressure of approximately 30. A 6% solution is osmotically equivalent to a 5% albumin solution. In the blood, it abstracts some water from the interstitial and intracellular fluids, thus expanding the blood volume somewhat in excess of the volume infused. The expansion persists for 1 to 1.5 days. Hetastarch is used in the prevention and treatment of hypovolemic shock. It is also used as a suspension medium for leukapheresis. Leukapheresis is the process in which white blood cells are separated from a blood sample. Hetastarch does not cause any coagulation abnormality like DEXTRAN. There is general but not complete agreement, but overall there is an agreement that it is less likely than DEXTRAN to cause anaphylaxis, any other allergic reactions like fever or chills. The incidence of anaphylactoid reactions is less than 0.1%. So it is much more safe and devoid of side effects in comparison to DEXTRAN.